To medicate or not. To medicate or not. We all know kids who can't sit still, who never seem to listen, who don't follow instructions, no matter how clearly we present them, who blurt out inappropriate comments at inappropriate times. Sometimes these kids are labeled as troublemakers or criticized for being lazy or undisciplined. However, they may have ADHD or ADD. ADHD makes it difficult to manage multiple tasks of daily life, especially complex tasks that require organization, planning, and sustained focus. Treatment for ADD and ADHD isn't just about taking medication. There are many other effective treatments that can help kids with ADHD improve their ability to pay attention, control impulsive behavior, and curb hyperactivity. Even learning better social skills are all a part of a balanced treatment plan that can improve performance at school, improve your child's relationship with others, and decrease stress and frustration. Medication. Medication can help with ADD and ADHD in their everyday life and may be a valuable part of your child's treatment. Medication is one option. One. Say one with me. One. Medication is one option that may help better control some, not all, some of the behavior problems that have led to the trouble in the past with family, friends, and at school. Medications for ADD and ADHD may help your child concentrate better or even sit still, at least for a short period of time. See what I mean? But to date, there is little evidence that they will improve in their school achievements, relationships, or behavioral issues over the long term. And even in the short term, medication won't solve all problems. Medication will not solve all problems or completely eliminate the symptoms of ADD, ADHD. Furthermore, there are concerns about the effects these powerful drugs have on a child's developing brain, and the side effects such as irritability, loss of appetite, and insomnia can come to be problematic. The bottom line, medication is not a cure. Medication is a tool. It is not a cure. It is most effective when combined with other treatments that address emotional and behavioral issues. What you need to know about medication for ADD and ADHD, everyone responds differently to ADD, ADHD medication. Some children experience dramatic improvements while others experience little to no relief. The side effects differ from child to child. And for some, they far outweigh the benefits because everyone responds differently. Finding the right medication takes time and the right amount of dosing. My sister was changed in her medicine over 6 times. Can you imagine going through this with a 7-year-old girl? Medication for ADD is more effective when combined with other treatments. We found other treatment measures. We found other alternative measures. We did have her put on medication, and the medication alone wasn't working. As I stated earlier, she was changed. Her medicine was changed 6 times in a 6-month period. Again, I asked to medicate or not. Medication is effective when it's combined with other treatments, but you've got to find the right treatment that works for you and your child. Your child will get much more out of the medication if he or she is also taking advantage of the other treatments that can teach new coping skills. So that's what we did. We had her a squeegee ball, and she could squeeze it and take it to class with her. So it was something for her to keep in her hands to keep, her kind of attentive and try to keep her hyperactivity down. ADD, ADHD medication should always be closely monitored. Medication treatments for ADD and ADHD involves more than just taking a pill and forgetting about it. Your child's doctors will need to monitor for side effects, keep tabs on how the child is feeling, adjust the dosage accordingly. When medication is not carefully monitored, it is less effective and is more risky. And if you choose to put your child on medication, that doesn't mean he or she has to stay on it forever. Although it isn't safe to bounce on and off of drugs repeatedly, you can safely decide to stop treating your child's ADD and ADHD with medication if things aren't going well. If you want your child to stop taking medication, be sure to let your doctor know your plans and work with he or she to taper your child off the drug slowly. As I stated to you earlier, my sister was on different medications for over a 6-month period of time, and one made her lose weight, one was too strong, one gave her insomnia, and then there was another that her mood swings were outrageous. So we decided to seek other methods, and we decided to try behavior therapy. And behavior therapy is another option that can help reduce these symptoms for children, and should be started as soon as a diagnosis is made. And I've listed some examples. Create a routine, get organized, avoid distractions, turn off the radio, turn off the TV, the computer. Have one thing going at that particular time when they're in there doing their homework. That was one thing that we did for my sister. We made sure that the TV was off, the radio was off, things that would distract her attention. We made sure that it was off. We would limit her choices of things that she could do. She could either go outside, or she could stay inside and read a book. So it was either read a book or go outside. So we limited her choices. It wasn't play a game, play on the computer, or watch TV, talk on the phone. We limited her choices. And change your interactions with your children. Instead of long, use clear, brief instructions or directions to remind your child of responsibilities. Use goals and rewards, and we did do that a lot. We gave rewards every time she came home with smiley faces, or every time she brought A's home or B's home. We could see her progress, and so we did a lot of things for the goals and the rewards. Discipline effective. Instead of yelling, we didn't yell at her. We used timeouts. We did use those, and we removed some of her privileges, and there was consequences for inappropriate behavior. There was even a time she got a switching. Help your child discover a talent. All kids need to experience a success to feel good about themselves. Find out what it is that your child does well, whether it's sports, art, or music. My sister, we found out that she loved soccer at that time. We don't know what it was with the pattern of the soccer ball, but that, for some reason, we signed up with the rec department, and boom, off the medication she went, because she was using all of that piled up energy, as we said. She was able to use it all out on that soccer field, and for some reason that ball helped her, and she would sleep with a soccer ball, and it calmed her down. It helped her stay at a normal working level, as we would say. But you have to know your child. You have to find the things that works good for your child. As I stated, my sister used sports, and it worked great with her. She loved music, so we found her CDs that she loves to listen to, the Kids Bob, and we found her some worship CDs because she loved the Gaither's Praise and Worship. She loved Mandiza, and so we found those things to help her, and she enjoyed those, and we were able to take her off medication. So in my conclusion, medication is said to help reduce the symptoms of hyperactivity, attentiveness, and impulsivity. However, medications come with side effects and risks, and are not the only treatment. Medication is not the only treatment. Medication is not the only treatment. However, medication comes with side effects and risks, and are not the only treatment. I know I said it but I'm making sure I get this across. Even when armed with all the facts, deciding whether or not to let your child take medication for ADD, ADHD, know the facts. Know the facts. It isn't easy. If you're unsure, don't rush your decision. Sometimes other medications or even normal children's behavior can be mistaken for ADD or ADHD symptoms. So be sure to eliminate all other possible causes before considering medicating your child. Take your time and weigh the options and get your child's input on the decision of making this process. We did, and my sister's been off medication. She started on medication in the elementary school. She went through to the 5th grade, and in the 6th grade, she was taken off the medication. She was weaned off the medication, and she's doing great. We learned to use the other methods. We learned to teach her how to cope. We taught her coping skills, and that's something as parents would have to do on an individual basis because each child is different, as I stated before. Most importantly, trust your instincts and do what you feel is right. Don't let anyone, be it your physician, be it your child's principal at your child's school, pressure you into medicating your child if that's not what you feel comfortable with. Medication isn't the only treatment option. Medication is not the only treatment option. For young children especially, medication should not be viewed as a first resort. It should be reviewed as a last resort, not the first course of treatment. As for my sister, we incorporated different alternative methods. We said several prayers and had a lot of patience. My sister's doing great now, medicine free for the last 8-9 years. She's graduated. She has a 2.85 GPA, graduating from high school. No medicine was needed there, and you would think that she would possibly need it back with having to take that the Georgia high school test, but she scored very well on all tests. She did great through high school. She's done great, and she's even enrolled at a Georgia Technical College this fall, and she's majoring in early childhood education. And I tell you, parents, the decision is yours to medicate or not. The decision is yours.